I think maybe a lot of women are unaware that hormonal birth control causes depression and dramatically increases risk of suicide and changes their preferences on who they want to marry or have kids with. It changes their personality. And it does say this on the box, by the way.
Okay, so I just pulled out my box of birth control, and nowhere on the box or in the inner insert does it say anything about suicide, changing your personality, and changing who you're attracted to. It doesn't say that. It does mention a rare side effect of potential mood changes or depression. Of course, we know that like many other types of medication, even some supplements, there can be side effects. But did you know that there are many different formulations of both hormonal and non-hormonal birth control? And yes, depression and mood changes can be listed as a side effect, but this certainly does not mean that everyone suffers from depression when they take birth control. And even those who may experience mood changes when they first start taking a new form of birth control, they may find that this is self-limited and resolves on its own. Within the option of hormonal birth control, there is a myriad of different formulations. There's estrogen-containing pills. There's progestin-only pills. There are some forms of progestin that act like a testosterone. There are some that kind of oppose testosterone-like effects. This is why you'll sometimes hear about women with PCOS, with hair growth, hormonal acne, being recommended to take certain types of birth control that have anti-testosterone progestin in them. There's also IUDs, implants, the vaginal ring, so many different options. Not every form of birth control is going to work well for a given individual, but there's so many different things that you can try, and it's certainly not a one-size-fits-all approach. I would beware of anyone who speaks in absolutes and relies on anecdotes. That's not very scientific, Elon. As someone with actual ovaries who's used birth control in the past, I will tell you that I personally relied on it during my entire 4-year OBGYN residency, which was very intense. I could not afford the anxiety and depression that I would feel the week before my period, and I couldn't afford to have heavy periods and cramps slowing me down. I essentially skipped getting a period and avoided ovulating for 4 years, and it helped me to manage my mental and physical symptoms so that I could get through. As a board-certified fertility doctor and an OBGYN who understands the nuanced pros and cons when it comes to individualizing birth control recommendations for each patient, I want to point out that these are blatant lies and fear-mongering, and clearly part of an agenda to discourage and limit reproductive autonomy for women.
They stopped taking birth control and their depression immediately disappeared. So that's maybe worth a try.
But then you miss an opportunity.
Maybe it's the birth control.
Then you don't get to go on SSRIs.
Yeah. And I think the SSRIs are the.
And demonizing women seeking help for mental health issues by using SSRIs, which is known to be a very effective tool at handling depression that can often be hormonally mediated from PMS, PMDD, or being postpartum. That's a huge red flag. One of the reasons why we have such a huge maternal mortality problem in the US compared to other countries that have similar amounts of resources is that we do a really bad job of supporting women in terms of their mental health during pregnancy and postpartum. So yeah, I'm not going to take advice on whether to use birth control from a guy that has 12 kids with 3 different women who clearly is pushing an agenda that is designed to limit reproductive choices for women.